I am Dr. Rajwan Pratap Mathur, Senior Most Endocrinologist in Andhra Pradesh and Telangana. And today we are going to join with the meeting.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
See, the main advantage of using only metformin as a drug of choice in most of our patients don't come under control. So we need an additive drug. And this new drug which came into existence after a lot of research, Imeglimin, it is an oxidative phosphorylation blocker, and it is the first agent in the Glimin class of drugs, glucose lowering medication, and it has been found to be quite effective in reducing the hepatic glucose output, increasing the glucose uptake by the muscles, and it also restores the normal insulin secretion, and also it increases the insulin secretion in a glucose dependent manner. So with all these properties in mind, I started using Imeglimin, and I found that most of my patients were getting better control. Even those patients who were on maximum dose of all the drugs, secretagogues, SGLT2, DPP4, insulin, still with sugar not coming into control. The addition of Imeglimin brought their sugars under good control. So I think this is a good molecule.
In what specific patient populations do you see the greatest benefit of using Imeglimin?
Long-standing diabetes and obese patients and patients who are not responding to the usual line of treatment for diabetes. We use Imeglimin, and we found that it's quite effective.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? You can share if any real-world case is there.
Yeah, we have seen the use of this drug in many of my complicated type 2 diabetes patients, and we did not find any untoward effects of this drug, no side effects. An addition of this drug to the usual anti-diabetic medication did not produce any additional side effects. So it's a good class of drug to use in our practice.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
Yes, sustained release formulation only reduces the dose of the drug. Instead of giving 2 tablets a day, you can do away with 1 tablet a day. So sustained release is definitely better in the sense that it reduces the dosing frequency. Otherwise, the mechanism of action and the benefits are same, whether you use Imeglimin morning and evening or Imeglimin sustained release only once a day. The action is same.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
I don't know exactly the effects of Imeglimin on the mitochondrial aspect, but I definitely came to understand that this drug is a good oxidative phosphorylation blocker, and therefore it is quite an effective additive drug to other antihyperglycemic drugs.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
I think even a prolonged use of this drug has not produced any side effects. So the question is of looking for side effects does not arise at all. So I think you can safely use it as a monotherapy, or you can use it as an additive drug.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
Yes, that is definitely a good drug to use, because Imeglimin has shown promising results in potentially protecting form of beta cell apoptosis and glucose-induced beta cell death also. So that may preserve the beta cell mass. So even in patients who are pre-diabetic, only giving Imeglimin as a monotherapy can improve their diabetic control, it can improve their beta cell function, and they can preserve the dying beta cell mass. When the diabetes comes, 95% of the beta cells are not functioning. Either they are dead or they are alive but not functioning. So those cells which are alive but not functioning, they can be regenerated by use of Imeglimin, because that will protect these cells from dying, and therefore the beta cell mass, effective beta cell mass will increase, and the diabetes comes under good control. So I think in pre-diabetes, this is a wonderful drug. Or in patients who are obese, who are likely to develop diabetes and who have got a strong family history of diabetes, giving Imeglimin is not going to harm them, but it is going to protect them from developing type 2 diabetes. As all of us know, that diabetes is a hereditary disease, and preserving beta cell function will definitely enhancing beta cell function, preserving beta cell function, and increasing the insulin sensitivity is definitely going to go a long way in even prevention of diabetes. So not only for the treatment of diabetes, but for prevention of diabetes in potentially diabetic patients who have got a strong family history of diabetes, this drug would be very useful. That is my personal opinion.
Any other key point or take-home message you would like to share apart from this?
No, my message is very clear. I am using nowadays Imeglimin as an additive drug for all my patients, and I have seen that the patients' insulin requirements also come down. So even those patients who are under good control with a particular dose of insulin and oral hypoglycemic drugs, when we added Imeglimin to them, their insulin requirements also came down, and that goes well with the fact that beta cell sensitivity is increased, beta insulin production is increased, therefore the insulin requirements come down. So I feel that we should try to add this drug to all our diabetic patients to give them a good glycemic control, which will ultimately prevent the micro and microvascular complications of diabetes.